Welcome to our channel HASHMICLINICS.
Welcome everyone. Today we're going to do a deep dive into one of our most profound polycrests, Antimonium tartaриcuم. We'll be breaking down its core essence, from its most dramatic acute presentations all the way to its chronic constitutional picture. Let's just jump right in with its most dramatic, its most defining clinical application. This single phrase, relieves the death rattle, it immediately tells you everything you need to know about its power in these extreme pathological states, right when the vital force is just on the verge of collapse. This is a remedy that works at the very edge of life and death. So, here's our roadmap for today. We're going to start with the core clinical picture, then move into that classic triad of symptoms. We'll cover the respiratory crisis, other key physicals, what causes and affects it, and then wrap up with some practical prescribing tips. All right, first up, let's really get a handle on the core essence of the Antimonium tartaricum patient. What is the central disturbance here? What's the fundamental weakness that gives rise to this entire pathological picture we see? This is pretty much the entire remedy in a nutshell. The whole clinical picture revolves around this one central disturbance, a collapse of the vital force. This leads to a state of, profound torpor and a total lack of reaction. And the result is this passive congestion throughout the body, but it's most critical in the lungs, where all this mucus just builds up and builds up, simply because the patient just doesn't have the reactive power to get it out. Now, the mental state here is just fascinatingly contradictory, and this is an absolutely crucial diagnostic clue. On one hand, you see this desperate neediness. The child clings to people, they want to be held. But on the other hand, there's this intense, peevish irritability. They reject any interaction, they cry if you even touch them, and they cannot stand being looked at or examined. This paradox, this clinging yet complete aversion, is a super powerful indicator for Antimonium tartaриcuм. So, building on that core essence, we come to this classic triad of general symptoms. This triad is so characteristic that it really forms the foundation of the remedy's picture. And honestly, it's almost always there to some degree confirming our prescription. Let's be really clear about these three pillars. The drowsiness isn't just being tired, it's an overwhelming, almost stuporous sleepiness that comes with nearly every single complaint. The debility isn't just feeling weak, it's a profound prostration, a complete and utter collapse of strength. And the sweat, it's characteristically cold, clammy, and brings absolutely no relief whatsoever. This triad really is the canvas that all the other particular symptoms are painted on. Okay, now we come to the very heart of this remedy's sphere of action, the respiratory crisis. Seriously, if you take away only one thing from this explainer, it should be Antimonium tartaricum's profound effect on the lungs. This is the one symptom you must never, ever forget. It's the sound. The sound that should immediately bring this remedy right to the front of your mind. This just captures the central pathology perfectly. The bronchial tubes are completely overloaded with mucus. You can often hear it from across the room, this coarse, bubbling death rattle. But here's the thing. Despite all of that, the patient has zero strength to clear it. The chest is full, but the cough is weak, it's ineffective, and almost nothing comes up. That sound? That is the sound of impending paralysis of the lungs. So let's be absolutely clear about what's going on here. The patient is suffocating. It's not from dryness or inflammation, it's from a mechanical obstruction caused by their own mucus, which they simply cannot expel. The vital force is so depleted that the very act of coughing does nothing. This leads to a state of progressive asphyxia. And as a direct result of this terrible oxygenation, the patient's appearance changes, and it changes dramatically. The face becomes cold, pale, and it takes on this bluish, cyanotic color. And this is often accompanied by that cold, clammy sweat we were just talking about. You can actually see the body's desperate struggle for air. You'll observe this fan-like motion of the nostrils with every single labored breath. This flapping of the alae nasi, which you also see in Lycopodium, is a critical, objective sign of severe respiratory distress that demands your immediate attention. Okay, so beyond the chest, Antimonium tartaricum presents with a lot of peculiar and really characteristic symptoms across other systems. It's a true polycrest, so its picture is just rich with these confirmatory physicals. So let's look at some of these other high-value symptoms. First, you have to look at the tongue. It has this characteristic thick, white, pasty coating, like it's been painted. In the stomach, we find two remarkable keynotes. First, intense nausea and vomiting that is uniquely better only by lying on the right side. And second, this extraordinary craving for apples, of all things.
On the skin, the eruption is pustular, it looks a lot like smallpox, and it leaves behind a bluish-red mark. And finally, you have to note the violent pain in the lower back, where even the slightest motion can cause retching.
You know, understanding the clinical context is just crucial for getting the prescription right. So let's look at what brings on this state and what factors influence it. The modalities and causative factors for Antimonium tartaricum are really clear, they're consistent, and they are extremely helpful in confirming the remedy. The modalities really paint a very clear picture, don't they? The patient is worse from warmth, especially in a warm room, and they get significantly worse when they lie down, which just increases that feeling of suffocation. They only feel relief from sitting bolt upright, which helps them breathe, and from any successful expulsion of mucus or gas. So these are the common triggers that can push a susceptible person into an antimonium tartaricum state. Notice that strong affinity for conditions that come from damp cold, like being in a cellar. It's also a key remedy for ailments after vexation and for the consequences of suppressions, whether we're talking about skin eruptions or even issues from vaccination.
All right, let's bring it all home and refine our understanding by placing this remedy in its clinical context, differentiating it from similar remedies, and knowing its unique clinical applications. That is the key to successful prescribing.
Differential diagnosis is so crucial here. Let's start with ipecacuanha. It also has rattling and nausea, right? But the key difference is that ipecac has this incessant, persistent nausea that is not relieved by vomiting, and they usually have a clean tongue. Antimonium tart's nausea, on the other hand, is relieved by vomiting, and it's followed by that profound drowsiness. Now compare it with Veratrum album in cases of collapse. Veratrum has a much more violent purging, a big craving for cold water, and that cold sweat is primarily on the forehead. And while they both can have that fan-like motion of the nostrils, Lycopodium just doesn't have the profound drowsiness or that audible coarse rattling of Antimonium tart.
Finally, let's go over some absolutely invaluable prescribing pearls. First, its use in asphyxia neonatorum can be literally life-saving for a newborn who's pale, breathless, and rattling with mucus. Second, remember it for that really unique lumbago, where any attempt to move causes retching and cold sweat. It's also indicated for the ill effects of vaccination when thuja has already failed, and as a key psychotic remedy, meaning it addresses that deep-seated miasmatic tendency toward overgrowth, it can produce characteristic warts. And clinically, it's just a vital tool for resolving those later stages of pneumonia when the lungs just failed to clear.
So this is the final thought I want you to carry with you into your practice. When you're faced with a patient who's on the verge of collapse, drowning in their own secretions, remember the key signals, that profound triad of drowsiness, debility, and unrelieving sweat, the unmistakable coarse rattle from a chest full of mucus that they can't expel, and that cyanotic face of despair. Recognizing that picture, well, that's the moment you can confidently prescribe Antimonium tartaricum, a remedy that truly can stand between collapse and recovery.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.